Good afternoon. My name is Dr. Rebecca Lee. I'm an associate professor in the UC College of Nursing and the director of the RN-BSN online nursing program. Our group presentation today is meant to highlight a collaborative effort that is being made to enhance the healthcare workforce diversity in Cincinnati. Funding for this project is made possible through a UC Urban Health Pathways grant. The UC College of Nursing, UC Blue Ash College, Cincinnati State Technical and Community College, and Cincinnati Children's Hospital and Medical Center are all committed to partnering to address the social determinants that impact the retention of minority nursing students at both the associate degree and baccalaureate degree levels, as well as their entry into the workforce. It is the aim of this project to facilitate opportunities and reduce barriers to success that will result in a more diverse nursing workforce. We are committed to developing culturally competent members of the healthcare workforce to meet the demands of an evolving and diverse patient population. Diversity within the nursing profession in terms of race, ethnicity, and gender is desirable because it can contribute to improvement of access and quality care delivery for minorities and underserved populations. The lack of diversity in the workforce can lead to cultural barriers, including language barriers, healthcare provider bias, and clinical uncertainty. It has also been reported that patients prefer provider similarity with regard to race, ethnicity, and gender. Unfortunately, the current nursing demographic does not mirror that of the population. The city of Cincinnati is highly diverse, with nearly 50% of the population being from racially and ethnically diverse backgrounds. However, minorities make up only 7% of the nursing workforce in Greater Cincinnati. In the state of Ohio, only 10.8% of nurses are non-white minorities. The Bachelor of Science in Nursing is the preferred degree due to growing evidence that BSN graduates contribute to the delivery of higher levels of quality and safe patient care. However, the associate degree in nursing is often the most attainable degree for entry into the field of nursing for many students, especially those from underrepresented and disadvantaged backgrounds. As such, intentional effort must be made to create seamless pathways for ADN graduates to progress to and complete their baccalaureate degree. Our project creates a unique partnership between the University of Cincinnati's ADN and BSN programs and Cincinnati State Technical and Community College ADN program with our affiliate hospital partner, Cincinnati Children's Hospital and Medical Center. This collaboration will create a pipeline by which selected underrepresented students in the ADN programs are co-enrolled in the RN-BSN program and are prepared for employment at Cincinnati Children's upon graduation. Additionally, Cincinnati Children's is committed to financially supporting their completion of the BSN degree while employed as a new graduate nurse. By creating seamless pathways to achieve both employment and continued education, we aim to ultimately impact the health of both the participants and the community in which they live and work as nurses. Now I'll turn the presentation over to Dr. Jennifer Ellis, the director of the nursing program at the University of Cincinnati Blue Ash College.
Thank you, Dr. Lee. Again, I'm Jennifer Ellis, chairperson and associate professor of nursing at UC Blue Ash. At UC, we all have a commitment to inclusive excellence, and that commitment extends to the healthcare side of what we do. The research is clear. The demographics of this country are getting more diverse. It is expected that by 2043, we will be a majority-minority population, and as healthcare providers, we need to support those patients. In order for patients to feel included and understood and to address healthcare disparities, we are all required to demonstrate cultural competency, but we can do more. The more is ensuring that our profession is as diverse as the population we serve. Having diversity in the profession supports improved patient outcomes and their satisfaction. It makes us patient-centered and better able to take care of whomever walks through the door. It makes a difference to the patient when they are being cared for by someone they identify with. But don't take my word for it. Let's hear what a graduate has to say about her experience and the values she has seen to being a diverse provider. Toni graduated from UC Blue Ash with her associate's degree back when it was Raymond Walters College. She then went on to get her bachelor's degree from the College of Nursing. Toni?
Hello, my name is Toni Mason, and I would like to begin by sharing my journey in nursing. I initially earned my associate's degree in nursing at Raymond Walters University. I later returned to the University of Cincinnati College of Nursing, where I earned my Bachelor of Science degree in nursing. I am now 2 weeks away from earning my Master's of Science degree in nursing from Walden University as a psychiatric mental health nurse practitioner, and I will begin my Doctor of Nursing practice program at Walden University in late November. I would like to share how I believe diversity play a positive role in patients' positive outcomes in nursing and the role that it plays. By understanding, embracing, and making a conscious effort to understand various cultures has a positive impact on patient outcomes. By allowing the patient to feel a connection, allowing the patients to feel comfortable expressing their concerns and their needs. Whether the connection is made through age, race, gender, ethnicity, or disability. It is very important that the patients feel comfortable having a conversation with us and sharing their needs in order for us to effectively meet their needs. So to do that as nurses, it is so important that we try to make a conscious effort to learn as much as we can about various cultures in an effort to better treat them. Thank you.
Thank you, Toni. Remember, diversity is about having our profession mirror the population. That means ethnically, racially, culturally, and includes other ways we are different, including gender, sexual orientation, and religion. To discuss the role of men in nursing, as well as the need for diversity among nursing educators, let me turn it over to Professor Jason Linville.
Hi, my name is Jason Linville. I'm an assistant professor in the nursing department at UC Blue Ash. Having diversity within our faculty members gives us a great opportunity to further relate to our students, and it also provides an opportunity for us to serve as a mentor to our students and make sure the traits that make us diverse. Exposing our students to diversity from day one of their nursing journey will help the students become more well-rounded with the diversity that they're going to experience caring for patients. The more that we learn from our differences, that be race, gender, sexuality, religion, economic, or educational, it's always going to better us as a nurse, and more importantly, it's going to better us as an individual. I definitely remember when I was a student nurse, I didn't have any male instructors at all, and there were very few male students. I mean, it was a great opportunity for me to learn from my female students and then female faculty-led staff in learning their perspective, and I learned a great deal, but it would have been nice to have more males or have a male instructor to look up as a role model to ask questions to. I definitely remember when I was a new nurse after graduation, I was really excited when I found out there was going to be a male that was going to be working maybe the same shift as I did, because I didn't get to experience it that often. And it was just nice to have someone to relate to. What it really did, though, it gave me a great perspective of what it must feel like for someone that might not be a little bit more isolated than what I was at the time. And for my 15 plus years at the bedside and my time in education, I can absolutely say that some of the best teams, departments I've encountered had that diversity in race, gender, age, and education. And those environments, they always seem to balance one another out, and they were just inviting, and they wanted you to be a part of it, and that's something you strive for. As an educator within the nursing department at UC Blue Ash, I think we understand the importance of diversity, and we are striving to bring more diversity as a team to better our students and better ourselves.
And now we're going to shift our presentation from the University of Cincinnati side of our partnership to the clinical partner, Cincinnati Children's Hospital and Medical Center. Representing Cincinnati Children's is Deanna Hawkins, Assistant Vice President. Deanna?
So here at Cincinnati Children's, we have core values and expectations that help support and move and drive our mission and our purpose here at the hospital. Core values are reflective and should be reflective of our fundamental beliefs and serve as the building blocks of behaviors and our actions as an institution. These core values are really simple. They make a difference, tell the truth, work as a team, and respect everyone. Most of these we learned in kindergarten, but even adults need reminders every now and then. So these are our reminders. So again, in addition to these core values, we have expectations. Our expectations are the way we put our core values into action. They're compassionate, they're collaborative, they're honest, impactful, and curious. And I'm just going to talk about one of those, compassion, in relation to diversity. So for us, being compassionate as an expectation here, we are held accountable to champion diversity, equity, inclusion, supporting everyone with caring, recognition, and intentional development. This is why we do what we do, and this is why diversity is important here at Cincinnati Children's. And specific to patient services, with a focus on nursing for the last couple of years, we have 5 priorities. One being to increase our recruitment of minority nurses, retain our minority nurses, advance, promote, and have career development for our minority nurses so they're advancing at the same rate as their peers, and also engagement, working on engagement, trust, and vitality of our nurses, and then also our leadership development. So having diversity, equity, inclusion, leadership development for the infrastructure, the people that work for the people, our greatest asset, which are our nurses and all of our employees here at Cincinnati Children's. And we feel that we give them that development, then we'll be better prepared to understand and to celebrate the differences that we want and we want to maintain here at Cincinnati Children's Hospital. Thank you for having me. Have a great day. Enjoy the rest of your symposium.
And now we're going to shift our presentation from the University of Cincinnati side of our partnership to the clinical partner, Cincinnati Children's Hospital and Medical Center. Representing Cincinnati Children's is Deanna Hawkins, Assistant Vice President. Deanna?